Hi, my name is Andrew Grindstaff, and today I'm going to be performing the SCAT test. My first question is what school do you go to?
I go to Scott High School.
What sport do you play?
I play football.
Okay. What date did your injury occur?
November the 4th, Friday night.
How old are you?
I'm 50 years old.
Gender?
Male.
What's your dominant hand?
I'm left-handed.
How have you ever been diagnosed with a concussion previously?
I did back in 2011.
How long was the recovery, do you remember?
It's about 2 weeks.
Have you ever been hospitalized for a head injury?
No.
Have you ever been diagnosed or treated for headache disorder or migraines?
No.
Have you been diagnosed with a learning disability?
No.
Have you been diagnosed with ADD or ADHD?
No.
Have you been diagnosed with depression, anxiety, or other psychiatric disorders?
No.
Are you on any current medications?
No.
So here I'm going to have you read this sentence, and then I'm going to have you fill out this form.
The athlete should be given this symptom form and asked to read this instruction paragraph out loud and then complete the symptom scale. For the baseline assessment, the athlete should rate his or her symptoms based on how she typically feels, and for the post-injury assessment, the athlete should rate their symptoms at this point in time.
The athlete had 4 total symptoms, and the symptom severity score was 4 out of 132. Do your symptoms get worse with physical activity?
No, not really.
Do your symptoms get worse with mental activity?
Yeah.
If 100% is feeling perfectly normal, what percent of how do you feel like right now?
Like 85, 90%.
Why?
I just feel like when I'm, doing homework or working on math problems, I have a hard time concentrating. My mental stamina is a little bit lower than it usually is, and just kind of feel out of it sometimes.
Now I'm going to have you do cognitive screening. What month is it?
It's November.
What is the date today?
Today is November the 6th.
What is the day of the week?
Sunday.
What year is it?
2222.
What time is it?
About 4 o'clock.
The patient scored a 5 out of 5 on the orientation score. Now I'm going to test your immediate memory. I'm going to read 5 words, and you're going to read them back to me as well as you can. Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, dog, truck.
Finger, penny, blanket, lemon, insect.
Finger, possum, blanket, insect, grass.
Finger, penny, blanket, lemon, insect.
Finger, penny, blanket, lemon, insect.
The patient scored a 10 out of 15 on the immediate memory score. Now I'm going to read you a string of numbers, and when I'm done, I want you to repeat them back to me in reverse order, how I read them to you. For example, if I say 719, you would say 917. 4, 393.
394.
629.
926.
3814.
4183.
3279.
9723.
62971.
17936.
718462.
263412 3.
The patient scored a 4 out of 7 on the digit score. Now I want you to read the months in reverse order.
December, November, October, September, August, July, June, May, April, March, February, January.
The athlete got a 1 out of 1 on the months test. The patient can read out loud. Now I'm going to have you tilt your head back. Tilt your head left, right, side, side. Can the patient perform the finger nose test normally? Patient passed that test. Can the patient perform tandem gait normally? Now I'm going to have your eyes follow my finger, but do not move your head. The patient has passed that test. Now I'm going to test your balance on your non-dominant foot. Now I want you to do a double leg stance, just stand on 2 feet. Patient passed that test. Now I'm going to have you stand on your single leg, but with your non-dominant foot. The patient passed that test. Now I want you to be in tandem stance with your non-dominant foot at the back. Okay, the patient has passed the tandem stance. Do you remember the list of words that I read a few times earlier? Tell me as many words from the list you can.
Lemon, blanket, insect, jacket. I think that's all I can remember.
Patient got a 3 out of 5 on that test. Now, the decision I would make is he scored a 4 out of 4 on his symptoms. I'm sorry, he scored a 4 out of 22 on the symptoms. His symptom severity score was 4 out of 132. His orientation was a 1 out of 5. His immediate memory was 10 out of 15. His concentration his digits backwards were 4 out of 7. His neuro exam was, it was normal. And there was no balance errors. His delayed recall was a 3 out of 5. I would say that he is concussed.